Joining me now in our newsroom is Dr. Christopher Doering, Vice President of Medical Affairs at Franciscan Health. Welcome. Always great to see you.
Thank you, Mary. Good to be with you.
So a new study from the Mayo Clinic came out showing breakthrough cases are occurring in fully vaccinated people who've had a specific shot compared to another shot. First, can you explain what a breakthrough case is and what vaccines were compared?
Yeah, I mean, we consider anyone who's been fully vaccinated and is at least 2 weeks after their last dose of that vaccine series to be fully vaccinated. If they then subsequently get diagnosed with COVID, we consider that a breakthrough case. And again, as we've talked all along, these vaccines are very protective, but they're not 100% protective. And so, and it's certainly understandable as time lapses from when they got vaccinated, that immunity starts to wane a little bit as well. So that's kind of what we're seeing. Some of the information that's coming out from Mayo and other places is suggesting that perhaps the protection from the Moderna vaccine is holding up a little bit better against the current circulating virus, the Delta variant, versus the Pfizer and the J&J. But it's important to know that they are all still holding up very well against severe COVID illness, hospitalization, and death.
Well, it's interesting because the Moderna and the Pfizer vaccine are both mRNA vaccines. And it's sort of, you had said this, put this very interestingly, it's like the same path to the destination. So I'm really curious as to why the difference.
Yeah, they do work similarly in terms of how they get your own body to help present the protein that they stimulate the immune response to. But they are slightly different in terms of the makeup of that fragment of the spike protein. So it's unclear whether it's the actual target of the immunity or if it's the immune response, the sort of robustness and the endurance of that immune response. We don't really know those answers at this point, but it does seem that the longer you go out, the more the Moderna seems to be holding up a little bit better than the Pfizer, but still both of them are quite effective at both preventing COVID illness as well as especially severe COVID disease, hospitalization, and death.
Right, because this was a sample, it was January to July of this year where the Alpha and the Delta were circulating. So we really have some sort of results as to how effective these are in terms of the Delta. I know we've been sort of wondering that. And we don't know what the mechanism is. Is that sort of the next step in terms of figuring this out for scientists?
Yeah, I mean, I think the questions, and we'll see if we get answers to them eventually. I'm sure we will. But is this because the immune response against one or the other is stronger and then lasts longer? Is it the nature of that immune response that one of them starts to wane more than the other, or is there something different about the protein and the component that's being targeted versus what's happening with these variants? And so a lot of this information that's coming out is still preliminary, hasn't really been published, if you will, so it hasn't been subjected to real rigorous peer review, but we're trying to make these decisions in real time and trying to adapt on the fly. So I think it does give us some insight into where we stand with the effectiveness of the vaccines and what the implications may be for the boosters.
Learn on the fly, right? Exactly what we've been doing. Just, I mean, this whole, 18 plus more.
That's right. Yeah.
And then those who have gotten the Pfizer shot, should they be concerned?
No, again, I think the Pfizer vaccine is holding up very well against severe illness. It certainly is protecting against hospitalization and death very, very well. I think they're all pretty comparable on that front. At least the two are, Moderna and Pfizer. So, we'll see going forward. There may be some different recommendations on the booster side of things. I know Pfizer has recently, earlier today, updated their information on the booster, and looks like that's going to be requested sometime after that 6-month window that boosting would be recommended for the Pfizer. I'm assuming Moderna will have something similar.
Well, Dr. Doering, so this also, I want to point out the states that were, this was 5 states that were looked at, and Indiana was not one of them. it's just incredible what's going on in Florida. I mean, after full vaccination of Pfizer, it was shown to have 60% less protection. Can we make any projection about what this might mean for Indiana?
Yeah, I mean, I think what you're seeing is a lot more breakthrough illness in states with relatively low vaccination rates, and where maybe things have been a little more sort of opened up, loosened up as far as some of the protections that were being taken. I think we're fortunate here in Indiana. We may not have the highest vaccination rate, but we did vaccinate at a very high rate our most vulnerable populations, and so from that standpoint, while the spread of the virus may still be seen amongst both some vaccinated and certainly unvaccinated, the burden on the hospitals, the severe COVID illness and the death is not going up at nearly the same rate. So certainly with that Delta variant being more contagious, we would expect to see more breakthroughs regardless of how effective and how enduring the immunity is. But certainly here in Indiana, we're holding our own, and the hospitals are, still hanging in there as far as the critically ill patients are concerned.
Right. I mean, I just read the most recent data. There were about 5,300 cases of breakthroughs in Indiana, and about 0.007% ended up with death, and they were sort of the really immunocompromised and older population. So
Right.
again, these are really holding up as you're saying.
Yeah, and of course the ACIP and the FDA came out last week supporting boosters for those who are immunocompromised. So certainly our transplant patients, our cancer patients, folks who are undergoing treatments that suppress their immune system, it is prudent and appropriate to go ahead and get a booster shot for those folks. I would expect we'll be hearing maybe additional groups recommended for boosters in the next few weeks, including possibly older populations as well, just to provide that extra level of protection and sort of revving up their immune system.
Well, that was interesting, because that leads to my next question. Right, I'm wondering if we're going to be adding to the list more people with the booster shot, and what would that look like in terms of the continuum, or how we would go? I mean, you mentioned the older population, but who else would we perhaps qualify?
Yeah, I think it'll probably target folks with some chronic illnesses as well that don't necessarily lead directly to immunocompromised states. So people with lung disease, for example, maybe even people with heart failure or other cardiac conditions, diabetes, would speculate that we may see some groups like that recommended. And then really, I would expect that the healthcare workforce, a lot of healthcare workers were vaccinated very early, that we were prioritized here in Indiana, as well as around the country. And so we were starting to be in that 6, 7, 8 months since the initial vaccine. So it's probably prudent to go ahead and prioritize that subset of the population as well.
So that's right. That makes complete sense. I mean, we were right. We had the first vaccinated. They were vaccinated very early on, and this group were vaccinated very early on.
Right.
And I just want to go back to the mystery behind the mechanism in which this is, because we have the mRNA. They're both the same, but we don't know the mechanism in which this is happening. But that's our next question that we want to answer.
Yeah, the way they were designed, they use the same ability to get the body's cells to produce and present the component of the spike protein, but the subcomponent that they're using is slightly different between the two. They're both have held up very well, very effective, but again, they are slightly different from that standpoint. And the mRNA technology, as we have commented all along, is pretty impressive in that if we determine that, gosh, this one's no longer effective, they could rapidly change the makeup of what that spike protein component is and deliver that on a fairly short timeline, in terms of subsequent rounds of the vaccine. Right now, we're still sticking with the original mechanism, the original formulation, but that could change should the evidence lead us in that direction.
Right, we could pivot, but like you said, that could be turnaround, quick turnaround because we already know
Right.
what we need to target. Um, Dr. Doring, always great to see you. Thank you so much for your time. Really
Yeah,
appreciate it.
Mary.